Paramedics entered the ER to save a woman in cardiac arrest. But minutes later, 6 people collapsed, not because of the patient's condition, but because she seemed to be toxic. This is the real story of Gloria Ramirez, the toxic lady.
The Toxic Lady, the chilling mystery of Gloria Ramirez. Gloria Ramirez was just 31 years old, far too young to have her name written into the annals of one of the strangest medical mysteries in modern history. She was a mother of 2, a woman with dreams, responsibilities, and the kind of daily challenges that millions face. Yet unlike most, she carried a heavy burden, a diagnosis of late-stage cervical cancer. For months, her body had been waging a losing war against the disease. Every day was a battle. One fought not only with medication and medical visits, but with determination to be present for her children. By the winter of 1994, her illness had advanced rapidly. Friends and family later described her as someone who remained warm and gentle, even as she grew thinner and more fatigued. She was known to smile through the pain, to hide her suffering as much as possible. But on the night of February 19th, something far more urgent than her ongoing battle with cancer drove her to the hospital. Whatever was happening was rapid and dangerous. An ambulance was called, and paramedics rushed her to Riverside General Hospital in California. When she arrived at the emergency room around 8 p.m., she was conscious, but only just. Her breathing was fast and shallow, each inhale a visible effort. Her speech came in broken phrases, slurred and confused. The staff noted that her blood pressure was dangerously low, and her heart was struggling to maintain any kind of steady rhythm. Every reading screamed that she was teetering on the edge. The ER team moved with practiced precision. This was their world, stabilizing critically ill patients, fighting to turn the tide in situations where every second mattered. Nurses and doctors worked side by side, attaching monitors, preparing oxygen, and setting up intravenous lines. At 8:15 p.m., the interventions began in earnest. An oxygen mask was fitted over Gloria's face to ease her breathing. An IV drip was inserted to deliver fluids and medications. A defibrillator stood ready in case her heart faltered. Nurse Susan Kane prepared to draw blood for urgent analysis, inserting a catheter with careful, routine efficiency. But that's when the night shifted from critical to bizarre. As Kane handled Gloria's body, she noticed something strange. Her skin seemed coated in a shiny, oily film. It wasn't the typical sheen of sweat from fever or exertion. It was thicker, almost unnatural. A nurse frowned, but kept working. Then came the smell. When Kane drew blood and transferred it into a vial, an acrid, sharp odor filled the air. She later described it as the smell of ammonia.
About coincidentally at the same time I smelled, ammonia. To me it was ammonia. And I kind of made a comment that, that's really strong ammonia. And I kind of felt, like I was going to pass out then.
Strong enough to make her eyes water. Before she could process the oddity, a wave of dizziness crashed over her. The room seemed to spin, her knees buckled, and she collapsed to the floor. The ER froze. This wasn't supposed to happen. Staff rushed to help Kane, but then, As though some invisible contagion was spreading, more began to fall. Maureen Welch, a respiratory therapist assisting with Gloria's care, suddenly swayed and slumped, unconscious. Moments later, Dr. Julie Gorczynski, a young and capable physician, began to convulse violently, her body racked by muscle spasms she could not control. The situation escalated from chaotic to alarming. In total, 23 members of the hospital staff would be affected that night. 5 would require hospitalization, including Dr. Gorczynski, who suffered severe lung inflammation and a condition called avascular necrosis in her knees, a painful and debilitating death of bone tissue caused by disrupted blood flow. Within minutes, the ER was evacuated. Gloria Ramirez lay on the gurney, the center of a scene no medical training manual had prepared for. Despite the exodus of personnel, a small core team in protective gear stayed behind to continue resuscitation efforts. They fought for her life for another 35 minutes, but at 8:50 p.m., she was pronounced dead. In most hospital deaths, grief is quickly followed by routine. Charting the time, speaking with relatives, arranging for transport of the body. But nothing about this was routine. Staff were reeling, not just emotionally, but physically, from symptoms that ranged from dizziness and nausea to muscle spasms and blackouts. The patient's death seemed almost secondary to the haunting question now gripping the hospital. What just happened? Fearing contamination, Gloria's body was sealed in an airtight aluminum coffin. Access was strictly controlled. The county coroner postponed the autopsy for weeks while hazardous materials experts tested for chemical or biological agents. The scene inside the ER was treated almost like a crime scene. Yet the tests came back empty. No nerve agents, no poisons, no radiation, no evidence of foul play. Toxicology reports on Gloria's blood revealed nothing out of the ordinary for a cancer patient. Her official cause of death was listed as kidney failure, brought on by cervical cancer complications. But for those who were there, this explanation felt like a dismissal. Kidney failure could not explain the oily sheen on her skin, and it certainly could not explain why healthy medical staff had collapsed, with some sustaining long-term physical damage. One camp of experts suggested a psychological explanation: mass psychogenic illness. In layman's terms, this is a form of collective hysteria in which a group, under extreme stress, begins to experience real physical symptoms triggered by anxiety and suggestion. The idea was that one person's fainting or nausea might set off a chain reaction, especially in a high-pressure ER environment. But this theory met with immediate skepticism. While it could perhaps explain dizziness or fainting, it did not account for the very real chemical odors multiple staff members reported. Nor did it explain the measurable medical damage to Dr. Gorczynski's lungs and bones. The "it was all in their heads" narrative didn't sit right with the people who had felt the effects in their bodies for weeks or months afterward. Then came a far stranger theory, one that sounded like it belonged in a science fiction plot rather than a hospital report. Scientists at Lawrence Livermore National Laboratory were brought in to examine the evidence. Their investigation focused on a substance called dimethyl sulfoxide, or DMSO. DMSO is a solvent sometimes used in industrial applications, but in the 1970s, it gained a cult following as a home remedy for pain relief. People would rub it on sore muscles or joints, believing it to be a miracle cure. Though largely safe when applied to the skin, DMSO can cause a garlic or onion-like body odor as it metabolizes. The Livermore team theorized that Gloria, desperate for relief from the intense pain of her cancer, may have been self-treating with DMSO. Under normal conditions, it would not be dangerous, but here's where it gets strange. With the oxygen administered in the ER, DMSO could oxidize into dimethyl sulfone, DMSO2. Then, when exposed to the electrical shocks from a defibrillator, that compound might, under rare circumstances, transform again into dimethyl sulfate, a highly toxic gas. Dimethyl sulfate is no joke. It can cause severe damage to the lungs, eyes, and nervous system. Even small inhalations can lead to headaches, nausea, seizures, and in extreme cases, death. The Livermore scientists proposed that the ER staff were essentially exposed to a cloud of poison that had formed inside and around Gloria's body. The theory was chilling and in some ways satisfying. It accounted for the chemical smells, the sudden collapse of multiple people, and the lasting injuries to some victims. But it also came with a problem. Most chemists argued that the transformation from DMSO to dimethyl sulfate required conditions far more controlled than those in a busy ER. And so, the case remains unresolved. Gloria's death certificate lists cancer as the cause, but her legacy is one of unanswered questions. Nearly 3 decades later, she is remembered less for the illness that claimed her life than for the mystery she left behind. A mystery that still haunts medical professionals and investigators. The Toxic Lady, as the media dubbed her, became a symbol of the limits of science in the face of the unexpected. Her story is taught in some medical and forensic courses as an example of how even advanced systems can be stumped. Somewhere between the lines of official reports and whispered theories lies the truth of what happened that night in Riverside General Hospital. Whether it was an incredibly rare chemical reaction, a freak convergence of medical and environmental factors, or something else entirely, we may never know.